Hello, my name is Dahlia Seiden. I'm the Urogynecology Subspecialty Registrar from Glasgow, and I'm presenting our paper on primary versus salvage urethral bulking agents. These are our disclosures as listed. And the aim and design of the study was to assess the success of urethral bulking agents according to whether or not our patients had had previous stress incontinence surgery, and this was our salvage group, compared to patients having urethral bulking agents as a primary procedure for stress urinary incontinence. This was a retrospective case series of women undergoing urethral bulking agents between 2010 and 2018. Patient-reported success was on a 4-point scale of cured, improved, no change, or worse, as utilised by the British Society of Urogynecologists audit database, and we defined success as patients who defined themselves as cured or improved. Our initial follow-up was at 3 months. Secondary outcomes included patients requiring top-up of their urethral bulking agents, and also patients requiring a second course of urethral bulking agents after the first course had worn off. We also analysed the success of urethral bulking agents according to patients' mid-urethral closure pressures, taking a mid-urethral closure pressure of less than 30 as an indicator of intrinsic sphincter deficiency. So looking at our results, we identified 170 patients over this case series, with 114 patients completing follow-up. If you look at our results from 2010 until now, you can see that our use of urethral bulking agents has gone up 4-fold since 2010. And looking at 2012, you can see that almost half of the urethral bulking agents were of the salvage type in the orange colour, whereas last year in 2018, 92% of our urethral bulking agent use was of the primary type. So results-wise, in our initial success, we saw a 10% increased success rate in the salvage group compared to the primary group with similar top-up rates. Despite initial success, however, 1/3 of patients in the salvage group went on to have a second course of urethral bulking agents compared to 1/4 of patients in the primary group. And then looking at mid-urethral closure pressures, just incidentally, in the primary group, the mean mid-urethral closure pressure was higher than in the salvage group, and overall success was higher in patients with a higher mid-urethral closure pressure. So in conclusion, we have demonstrated that initial success was higher in the salvage group. However, more salvage patients went on to have a second course of treatment. And although we saw marginally better results with mid-urethral closure pressures of greater than 30, we have demonstrated a success rate of 60% in women with suspected intrinsic sphincter deficiency. Thank you.
Now, the audience might be very confused that you offer what is generally thought of as an inferior treatment for primary stress incontinence. And this is because this good lady works in Scotland, and the Scottish Parliament banned the use of synthetic tapes for the last 3 years?
Yes, so we had a temporary allowance again, but now it's been banned again. It's on a pause.
So you're not here to propose that bulking agents are the best treatment. You're here to describe the difference between salvage and naive patients. Is that correct?
Absolutely, yes. Because of our limitations with using mid-urethral tapes.
So as a bit of further background, NICE, which is the organisation that recommends treatments in the UK, also suggests that you offer women colpo suspension and fascial sling, as well as an injectable.
Yes.
Was that your practice in Glasgow, to offer the 3 operations?
We offer everything, yes. Yeah.
But they primarily choose bulking agents.
So now what we're seeing is primarily patients are choosing bulking agents.
So what do you feel about the slings? If the sling became available again, the plastic sling, TVT, TOT, would you go back to using that?
Absolutely.
Right.
On a personal level, I would choose it as a first choice treatment for stress retropubic sling.
Right. Are there any questions?
What about complications and the difference between the primary and the secondary procedures?
So complications, we looked at voiding dysfunction, which was the main complication, and they were comparable between both groups, as shown on this graph. But we haven't seen any major complications. Just incidentally, initially in our case series, we saw some bulking agent abscesses, but we haven't seen that recently.
Okay.
Thank you very much.
Thank you very much.